We've heard of COVID fatigue and the impact on mental health during the pandemic, but doctors are finding that there is a tough problem for people who are recovering from the virus. Fox 13's Lauren Steinbrecher is live at Intermountain Medical Center in Murray to explain how contracting COVID-19 can leave you with more than just physical symptoms. Lauren.
Yeah, Bob, a psychiatrist here tells me that they are finding people, especially those who were hospitalized from COVID-19 or family members of those who contracted COVID-19, are left with mental health impacts that will stay long after this virus is gone.
These pictures show Tressa as her life was before the pandemic, before she was diagnosed with COVID-19 in April.
I can definitely say I'm not the same person that I was before I had COVID.
Not the same. Tressa became a COVID-19 long hauler, where physical symptoms took over her life for months, effects that impacted her mental well-being.
I just got really depressed, really anxious, really, my outlook on life really seemed to change. I questioned all of my beliefs because I could not understand why this was happening to me.
It is going to be an issue for a significant percentage of our patients who develop COVID.
Dr. Travis Mickelson, Medical Director of Mental Health Integration for Intermountain Healthcare, says early studies suggest that 20% of adults who contract COVID-19 will have some post-COVID mental health issues like PTSD, anxiety, and depression.
That likely will depend on what their course of illness was. We are more concerned about those patients who part of their journey involved the ICU.
He says the effects will likely last for months to years afterwards and can extend to family members of COVID-19 patients or family of those who died from the virus. He encourages people.
What we need is you to reach out and connect to your primary care provider so that you can get the support and resources that you need.
That's exactly what Tressa did. She says she now sees a therapist for her complex PTSD.
My physician has put me on some medications to help with that as well.
While life hasn't returned to the way it was before, Tressa says she's been feeling better. She's now part of a support group online and hopes to help others get through this.
But we're here to help you. Reach out to us, reach out to your therapist, reach out to your doctors, and find the help that you need, because you're definitely not alone.
Tressa says she is part of an online Facebook group called Utah COVID-19 Long Haulers. Meanwhile, Dr. Mickelson says that here at Intermountain, one of their top priorities is to increase the number of support groups for those who are experiencing those effects afterward, and also grief support groups for those who have lost someone due to COVID-19. Live in Murray, Lauren Steinbrecher, Fox 13 News, Utah.